Hi guys, here's an update on what happened at the Maya versus John Hopkins trial. Now today they talked to two people, Dr. Timothy Brereton and Dr. Kirkpatrick. But first we're going to talk about Dr. Brereton. Now he had evaluated Maya and he had talked to her and about her stay at the hospital and before her stay, what life was like and stuff like that. And he had diagnosed her with PTSD, and he said this did not happen before she went into the hospital. This happened during her stay at the hospital, and after she got out, it got worse. Now she is suffering from major depression, major anxiety, and she's been very traumatized by her stay at the hospital. Now, he did talk to, Jack and Kyle, and throughout this whole thing, her having to stay at the hospital and deal with all this stuff by herself, and then also having to deal with the passing of her mother. Of course, Jack got diagnosed with PTSD, and so did Kyle, and he's got a lot of major depression and anger issues over everything that had gone on. Now, it's going to be quite interesting as Maya gets older. They said that, she is, thinking about going to college and getting back out in the world again, and that she's going to have to learn to, I guess, have the necessary tools to help her during these certain stressful situations. Now, if you ever had CRPS, you'll know that stress can trigger that syndrome, and it can really, just take its toll on you. And that's what she and everybody has kind of been saying, stress does trigger these things in, CRPS patients. So she's going to have to really, focus if she wants to, get back out there and do the, socialization again. So we'll have to wait and see that. And that, John Hopkins made the CRPS a lot worse than it should have been. And if they hadn't done everything that they have done, she probably would have gotten out a heck of a lot sooner and everything would have been fine. But the fact that that went on at the hospital, it was completely unnecessary. So even have her stay there was completely unnecessary. So that is what his diagnosis of her was. Now, Dr. Kirkpatrick, now that was a really good testimony, because he basically said that, he had talked to Beata and that she was a very, concerned mother over what was going on with her daughter, and that he knew right away that she was suffering from some kind of chronic illness. And he said that, when you see certain things in CRPS patients, you're going to see discoloration. You're going to see, just, light to touch is, very painful for them. And he noticed that, her legs and arms and most of her body were very painful when you touched it. So he knew right away what this was. And he had other patients that had kind of been through similar thing. But the only thing is Maya also had dystonia, which was why her feet were turning in. Now, she had a very severe case of that. Now, he also said that, of course, her pain tolerance, her having to not get the necessary medicine like the ketamine, and her, in her mind's like, okay, I got this level of pain tolerance, I'm just going to have to deal with it. And it is just horrible, the horribleness that she had to go through, because they wouldn't give her the necessary medicine that she needed that actually helps reduce the pain in CRPS, I'm sorry. Now, it was just, of course, Maya is a very intelligent, very smart, and very curious girl. He saw that right away in her, and he said that he really got that from her mother, who was very, just smart and, strong-headed. Now, again, when you have CRPS, it's going to attack the nervous system, and you're going to get lesions. And he noticed that right away on Maya, that, you know, her right leg was a little bit more sensitive than her left leg. Now, again, that'll happen in some of the, you know, patients. It just depends on the patients. Now, Maya did do her physical and aqua and sorry, I can't talk today. Conjugative therapy. I'm saying that wrong. I'm sorry, you guys. It's been a long day. And he talked a lot about how he had coincided with Dr. Smith, who's going to be testifying, I think, either tomorrow or Thursday or Friday. I can't really remember. I think it's one of those days. But plaintiff is going to be finishing up. So that is what's going on. And now, you know, he says that, you know, this is what was going on in her brain. Now, normally, you know, when we get poked, or if we accidentally hit ourselves or bump ourselves into something, it's going to hurt. Now, normally that pain will go right away if it's not too severe for us. But, you know, in time, it does go away. But for CRPS patients, it's a continuance. Now, if you even get a light touch on your head, or if a feather even touches you, you're in a tremendous amount of pain for who knows how long. And that is why this disease is just so sad, and, you know, why they're trying to still study it, because, you know, there's just not a lot to go on, and they're still trying to figure things out. Now, because of this, and again, I said earlier that Maya doesn't like to go to hospitals. She doesn't like doctors. All this was her, you know, due to the fact that she was staying at Johns Hopkins. She thinks it's going to happen again, and she doesn't want to go through that again. So she tries very hard to avoid going to the hospitals and going to doctors. Now, yes, she has been in some hospitals, and she hasn't had to ever stay as long as she did in Johns Hopkins. Now, in Johns Hopkins, she stayed for 3.5 months. Now, other places now, she's only had to stay for longer than a week. So it was, you know, pretty good. So I think that if, again, they had done their job, then she probably could have been out, you know, of that hospital within a week, and not 3 months later. Now, of course, the defense tried to downplay everything and tried to discredit Dr. Kirkpatrick, but he held his ground, and he said, no, this is what was going on. And yes, she saw other doctors, but no other doctor that she had seen could pinpoint what was wrong with her except him. He was the only one that could give them a diagnosis of what was going on with Maya. And so that is what happened in court today. Now, tomorrow, again, I think it might be Dr. Sally and probably Jack again. I'm not really sure, because they weren't in court today because Jack was sick, so, which is Maya's father. So nobody was in court today. Now they might be there tomorrow. I'm not really sure. But again, if you want to watch that Maya testify, you can watch the trial on Law and Order. Just go on YouTube and it's there, and you can rewatch everything from the beginning if you like. Again, the trial starts very early in the morning, so that's why I am up at the crack of dawn so I can watch it, because of, you know, time change. So anyway, I'm going to be going live tonight at 8 o'clock to 10, and I'll be talking about true crime stories. So if you like true crime, please come and join me. And I hope you guys are having a good Tuesday, and you have a good rest of the week, and I will see you later tonight. Okay, bye. I think I should do my hair blue. No, I'm not going to do that.